Hi, everyone, and welcome to another episode of Aila Health Patient Spotlight. I am here with Klyn Elsbury. She was born with cystic fibrosis and told that she wouldn't live past the age of 14, but she has spent most of her life growing up inside hospitals battling the disease. Now in her 30s, she has endured over 67 hospitalizations and built a sales consultancy teaching sales managers and their teams how to become champions in their industry. She is a two-time best-selling author, sales expert, motivational speaker, whose expertise has appeared in over 150 publications, including primetime debut on NBC Nightly News with Lester Holt. What an honor to have you here with us today, Klyn. Welcome.
Oh, thank you. Thank you. I'm really excited. I think we're going to have some fun on this.
I think so. Why don't you just, begin at where you would like to. Just give us an idea of where you're at with your health journey and what that's been like.
Yeah. So I am on, in the last year or so, it's been the healthiest couple years of my life, which is ironic considering the state of the world.
Yeah.
I really attribute that to not only some dramatic lifestyle changes I've made. I'm very blessed that I qualified for a treatment protocol that has worked really well for my specific mutation. So as far as where I'm at now, I think a lot of people, they find out about the 67, 68 hospitalizations. I'm like, oh my goodness. But the reality is my lungs have never been healthier. I've never been fitter. I've been out of the hospital. I remember in February marked 1 year hospital free, and it was the longest I'd ever gone in my life without one. So right now, knock on all the wood you can find, but right now I'm in a very stable and incredible place in life.
That's incredible to hear. What a benchmark and a reason to celebrate for sure, that 1 year without hospitalization. And I'm sure one of the questions that might be coming to mind for folks listening to this is how, you're at this place where you're feeling really healthy, the healthiest that you've been. Can you give us some insight to what that health journey has been like, how you managed to find your place and where you are now?
Yeah, so it comes down for me, and knowing I'm definitely not giving medical advice, right? But knowing for me, when things were a lot darker, and I talk a lot on stage about, and in the books about what the dark days were truly like, it was, just keep adjusting that goal. So maybe the goal isn't to, become a Zumba instructor, which I did in my early 20s, but the goal was to be able to walk up the stairs without coughing. And, it seems comparison mode that that's not really a great goal because most of society can do that. But for me, that was the goal. And then I just kept readjusting it. And sometimes the goal was very, very, very small and embarrassingly so. But just to know that, like, no matter where you're at in your own journey, you can adjust the goal to something that works for you. And then what really worked for me was, and it sounds so cliche, but there's a reason they're cliches because there's truth to them. I tapped into, my beliefs in God. I worked out a lot, more than maybe I should have. And a workout, in the beginning, a workout was literally walking up a staircase, trying not to get winded, and every day pushing myself. And then I did the thing, I cleaned the diet up, 100%. And of course, that with the treatment protocols and some of the blessings of modern medicine, it's that combination, I think, that really made that difference for me. But I think it always starts mentally, right? Mm-hmm. And then all these other forces come into play.
It sounds like you're really bringing that mind, body, and spirit into this healing journey.
Yeah, there's a fascinating, and I believe in modern medicine, so I don't want to accidentally get labeled in one of those, but there's this incredible book I remembered reading in the hospital by Lisa Rinkin, major international bestseller, and she talks about mind over medicine. And there's this huge study that draws that correlation between health and mental health, right? Mm-hmm. And it's interesting that I had a really wonderful childhood and incredible 20s, but at the root of who I was, really insecure. And a lot of times I felt very lost. Who am I? What am I about? Do I have any talents? How come all these other girls are prettier? Like, whatever that story is that I wanted to own in that moment. And it's no surprise that my health just kept deteriorating. And then so did my self-worth and that side of it. So just kind of owning who I was in that power, I think that was the catalyst to having modern medicine work for me, and getting affiliated with a wonderful church, and getting back to the gym in a way that empowered me, and cleaning up the diet. If it didn't start there, where would it start? And I don't think it would have.
And it sounds like, making some small change in one area of your wellness really just started to expand into all these other areas, started to feel better here. You can start to feel better in this other area, and just, snowball effect.
Yeah. I mean, and that's what it is you become addicted to seeing your own progress. Right. And for me, it was so simple. 1 flight of stairs, try not to cough, 2 flights of stairs. Can I walk down the block? And then a week later I'd get hospitalized, and I'm like, no, I just did everything right. And it's like, it's okay, boo, you did everything right. Now go do it again. Cause nobody has it easy. Everybody has their own struggles. So for me, it was a really kind of cool thing to get addicted to seeing the progress, and then just continuing, to calibrate. It became a game for me.
And I imagine there's certainly a strong element of self-compassion that comes into that as well, right? Of feeling like, okay, I'm making these achievements, I'm walking up the stairs without coughing, and then, next thing you know, maybe ending up in the hospital. And that in and of itself sounds like a mental battle to overcome, of like feeling like you're doing better, and then maybe feel like you're taking a step back.
Yeah. And I mean, 2 steps forward, 1 step back, right? Gosh, I'm like the world of cliches on this, but also true. Right. And so for me, it was like a baby step forward and 6 steps back. And I'm like, but what's the alternative? And the alternative was, I don't get to see my family in another couple of years because I didn't make it. And so then you really tap into that sense of why and what really is important to you. And when you start to come to terms with those answers and that self-compassion you talk about, they always say, if you take that first step, the rest of the steps will appear. And so that became my game plan for 2 to 3 years. Like, just see if there's hope, and rely on it. Don't get me wrong. Like, definitely pray for hope, but work as if it actually depended on you. And that's where it was a really interesting catalyst for my own health and transformational journey.
Yeah. And what I'm hearing from this too is it's not something that happens overnight, right? That this was years in process.
Yeah. I didn't know that it would ever happen, actually.
No,
I mean, I wanted it to, don't get me wrong, but there's something about owning the fact that, like, maybe that's not the card I was born to play. And from that, it's like, okay, so what can we do with what we have? And, that taps into that sense of why again, right? So if I only have a year left and I'm antibiotic resistant to everything, well, what's the point? The point is there's probably something I'm not seeing or something I'm not experiencing that I have to do yet. And, I don't know the severity of who may or may not be watching and listening to this, but I can say that, it was really dark for me for a while. And I remember when I had my 30th birthday, like 180 people showed up. And in a weird way, I was like, wow, cool, I'm popular, right? And then in the other way, I was like, but am I popular because these people don't think I'll make it to 31? And it was a really like a weird birthday, because I remembered feeling so loved and adored, and they made it Sex and the City themed, so it was pink and like everyone had their own cocktails and it was just lovely. And then I remember thinking, like, maybe it's just so great because people don't know if they'll get to see this again. And so that, like, knowing that others relied and got to be with me in moments of happiness too, was the catalyst to, like, just keep putting your foot out there for the next year, appreciate how it's unraveling as it goes, because we all have different fabrics of our life.
And all we have is this moment, right? That's true. No matter, if we have a chronic illness or not, right? We never know. That the future is never a for sure thing.
Yeah.
Klyn, would you mind just, walking us back here, and, for those who might be listening in and not really sure what cystic fibrosis is, can you just give us a little bit of context around that, and, what some of the challenges are that can come up with living with that is a chronic illness?
Yeah, great question. And thank you for that. I am just like, what do you mean not everyone knows exactly what this rare genetic disease is? Come on, y'all. No, I kid. So cystic fibrosis is a life-altering genetic disease, meaning you're born with it. And it really affects all of the mucosal systems in your body. So your lungs essentially fill with a thick, sticky mucus that you can't cough out. And after repeated attempts to get you to be able to expel that mucus, if the infection still remains, then you start to develop something called antibiotic resistance due to the antibiotics you need to take to treat that. Many times, should somebody have cystic fibrosis, their pancreas does not properly work. So there's malabsorption of food, which can lead to something called pancreatic insufficiency. And then, of course, that leads into diabetes. So it's a certain kind of diabetes. It gets a little dicey. But the moral of the story is we're very, very prone to lung infections that do not ever fully heal. And I think that's a good way. There's over 1,800 mutations. And I think there's 70,000 people in the world right now with cystic fibrosis. So what that means is everybody's different. But the telltale sign, and this is fun party trick, if you were to like lick your finger and then lick my arm and then lick your finger again, it's going to taste salty. So in the Middle Ages, there was actually this poem that said, "Ye beware of thy child who tastes of salt, for they soon shall die." And so that's the number one telltale sign because of a sodium chloride imbalance in the skin. So I hope that was a good enough recap.
Well, I certainly learned some new things there. Thank you so much.
Be salty.
So it sounds like it's more than just like, okay, if you perspire, like it's going to have kind of a salty taste, but it's just like the actual, skin composition or chemistry that, yeah, wow.
Yeah, that's fascinating.
So one of the first things that comes to mind in hearing you say this, that there's over, how many different mutations did you say? Like
last I heard 1,800.
1,800, so that, I think, wow, there's so many different mutations. So how in the world does somebody navigate through the healthcare system if there's so many, mutations? And yes, everyone is different, but does that make it really challenging when we're talking about finding care for something that is so variable based on the person?
So there is something called by all means, if anyone listening is thinking they or somebody they love may have cystic fibrosis, just go to cysticfibrosisfoundation.com. There's certified care centers all over the world. I know by me, I'm blessed in that there's like 3 within a drivable distance. And so really every care center has treatment protocols for every type of genetic mutation, because it's all in the severity changes. But the reality is like, we're going to have lung infections. We probably won't digest food. At some point, we're at a risk for diabetes, and our skin is salty. So, I mean, once you know that those are the telltale signs, there's treatment protocols that work for all those mutations for the most part, right? And so, yeah, if you just go to that website, you should be able to find a care center, and it's called a CF accredited care center for those Googlers out there.
Yeah, definitely looking to accredited sources for information.
Instagram is not accredited, y'all.
Yeah, so it certainly sounds like, given your your experience and your speaking and publishing, it sounds like you're a voice in the community. What are some methods for advocating with this pretty rare disease?
I've found, for me, it's so interesting you say that, because I don't see myself like that. So, working with that, there's so many brilliant voices out there, right? Summer Love is one on Instagram. She's a gem from Utah, and her whole thing is obviously, get this, love, works for her name. So I follow her constantly. There's some great athletic affiliations that do a lot of good work in the CF community. And so there's so many wonderful voices, but I think what helped me gain so many followers and some traction in this space, if you will, is I'm just so authentic. Like, I'm not going to tell you what I think you want to hear. I'm not going to sugarcoat it. I'm going to say things like boo-boo or just straight up, you're wrong. Like, I don't skirt through the truth just for the sake of having life appear perfect. I've shown video clips of the nurses trying to access my port and missing. I've shown the bad and the negative of hospitals. Like should anybody, want to listen to the Audible book and use your credit. It's funny, I recorded that in the studio, and, when you have barely a functioning lung, you cough. And the producers had told me, we should really edit out the coughs, and because it's distracting to a listener. And I was like, absolutely not. Like, I put my foot down on it. So when you listen to the Audible, like, you'll hear me struggling to breathe as I read you my book. And so it's like, because I'm not going to paint a pretty picture just for the sake of being that poster child, because I just didn't care. And so it's an interesting dynamic. I think that that's really, should you have it, and being not only authentic, but like, we all know those people who they're seeking the attention, right? So, and I hate to say it like that because everyone's different and maybe that's their coping mechanism, but I never sought out the attention. I never tried to go viral, and I just tried to be famous with it. I just tried to say, hey, this is my life. You can judge me or not, and it's okay. But there's going to be that one person who needed to hear that message today. And so I think that's what worked for me. And, the influencers that I tend to follow have a very similar approach. And I think that's what makes it fun. And that's what makes it, to your point earlier, community, not just a voice.
Yeah. And I appreciate you saying that too, about bringing in this strong and authentic voice, is unapologetically authentic, right? Because people just, are looking to, cut through the BS, right? Like, in their, internet searching. Yeah. They just want to hear the truth. They just want to hear, like, what is your experience like? Am I the only one who is suffering in this way? Like, are there other people out there? So it sounds like, and, from what I'm seeing too, just bringing that freshness into this space and just telling people how it is, this is how my life is. And, some of it might stick with another person's experience, or maybe it doesn't, but, that doesn't even matter. It's, connecting with those people who do feel like they're, alone in the struggle, needing some inspiration, or just knowing like someone out there is suffering like I am, right?
Yeah. And I don't obviously, I don't hold back. Watch some of the keynotes, right? You'll find out. And I'm a very there was a newspaper, I don't know, it was back when they had newspapers. There was a headline about me that was like, forthright and gutsy, Klyn takes on the community. And I spoke out about some of the things that were not right about treatment protocols, knowing that I'm not a medical doctor, and I'm not doing this to create more in the cancel culture, right? That wasn't a thing back then. It was, no, this is not factually how I want to operate. So I'm not going to own that power. And a lot of it actually came down to business, right? Cystic fibrosis patients can't work because then you're going to subject yourself to diseases or like infections. And I remember they told me like, oh, you can't be a teacher, because then you'll be in a classroom, people will be sick. And it's like, okay, yeah, I know, but like people are going to be sick everywhere. And if you find that one thing in your life that gives you meaning and it's worth your life, like, why wouldn't you go after your dreams? And so now looking back that I'm blessed to be healthy, it's like, did I make some mistakes based on some advice of what others well-intentioned told me? Yeah, of course I made mistakes, but it's no surprise that now I'm a teacher for businesses and organizations, because like I still owned that was who I was. And when you find your purpose and your light, don't hide it out of fear, don't put those thoughts in your head. And so I think that, just circling back, that forthright and gutsiness and the ability to stand in your truth and say, this is who I am and what makes me who I am, I think was a really refreshing voice. And that, totally helped my brand.
Yeah. Funny what can happen when you're really living through your heart, right? Yeah. And just following your passion, but hearing you talk about some of these, I don't know, maybe barriers that you've had to kind of move through with people telling you what you can or cannot do. Are there some misconceptions that people tend to hold around cystic fibrosis, or maybe is it just a lack of awareness? Not to say that in a judgmental way, but is there just not an education around this that people maybe just don't know?
1,800 mutations. The thing about that is you have to make blanket statements because everybody's different, right? Mm-hmm. So I know if I'm in a very large room and let's say there's 1,500 people and I'm giving a keynote, that keynote cannot be incredibly specialized because I've got to take the consensus of what that 1,500 people believes. If you and I are having martinis on a beach, I can be a little bit more real with you because I only have to worry about your perception and I can test it, right? So I would say the biggest thing, and minding that I don't know who's listening or what mutation they have or whatever, is my life changed when I disagreed with a lot of the nutrition protocol. I understand that we have issues losing or gaining weight because of malabsorption, but I stand by my personal truth. And again, everybody's different. So if you're listening to this and this charges you, just know this is for me, not for you, because I don't know you. But I got to a point where how is mac and cheese with butter and sour cream and bacon nutritious? And when you're a full-blown diabetic at a very young age, because you go into a coma, and you start to have all of these insulin resistance issues, which then create lung exacerbations. And then it's a vicious cycle. For me, I just started really looking into what food does for the body outside of that type of protocol of fatten the CF kid up, which is the big joke inside the community of patients. So I found for me, that was one of the things that I was very outspoken about. And for many people, it does make a lot of sense. So I'm not negating that at all. It's a tough thing to admit publicly, but just make a look and say, okay, is what you're doing, if you're not seeing the results you want, is what you're doing actually making sense? And it's okay to experiment and try some things, maybe a little less butter, cream cheese, sour cream, and bacon on top of mac and cheese is a good solution. Maybe it's not, but you, at the end of the day, it's your body and your temple. So you make that decision based on you.
And it sounds like, what you're saying here too is not being afraid to ask those questions, not being afraid to ask your healthcare provider, your nutritionist, or, your care team, like, why am I doing this? Does this make sense for me?
That's a brilliant way to word it. Yes. Ask them, why am I doing this? Because it just doesn't make sense for me. Mm-hmm. And they can shed some light as to the reasonings why, or they can work with you to find something more custom. So that's a brilliant, brilliant idea.
And, to take that one step farther, perhaps if they aren't willing to work with you, maybe that's a time to consider someone else to inform your healthcare.
Yeah.
And to not be afraid to switch doctors, right?
Yeah,
because it's your body. Yeah, you know your body better than anyone else.
I always say, you're not a tree, you can move.
Yeah. Wow. Yeah, that's really powerful, and inspiring. It's like, your health is just not at the mercy of the doctor that you're seeing, that there's a lot that you can do, right? That you can learn and research and bring in your own questions, right?
Yeah. Don't be afraid to fight for what's important to you. And really, the most important thing you have is your body.
Yeah.
Mic drop.
I know. Oh, that's perfect. And just in closing, Klyn, is there any advice or maybe tips or any other words that you would like to share with folks who might be listening in and just feeling, like they're struggling and just wondering what to do next?
Yeah, I'll be super cheesy. And I'm going to end with the opening quote in my book, which is, "A bird sitting on a branch is never afraid of that branch breaking because its trust is not on the branch, but in her own wings." That's all I got for y'all.
That's so beautiful. Well, thank you, Klyn, so much for being here with us and sharing your story and speaking words of inspiration and hope. And if you, before we close, do you mind just sharing the name of your book in case those who are interested in looking it up?
So use your Audible credit for I Am the Untold Story of Success. And then obviously you can get the paperback version as well. But if you just type in KLYN into Google, everything will show up. It's a very niche name.
And I'll post the link to your book in the description down below as well.
Yeah.
Well, thank you so much, Klyn, for being here with us. Really appreciate you.
Of course. Thank you for the opportunity. Bye, everyone. Have fun.